One of the greatest developments in dental therapy over the last 25 years has been porcelain veneer therapy. Let me tell you a little bit about porcelain veneers first, what they are, how they're made, and then I'm going to get into the protocol. Porcelain veneers are nothing more than a tiny shell of porcelain that are manufactured in a laboratory, and then they're going to be applied to the surface of your teeth to create a certain illusion, whether it be to change your color, the size, the shape, the position of your teeth. So to actually place them and make them is pretty predictable. But there is a specific protocol that we have to follow from beginning till end so we get this right the first time. We don't want you to have to redo your veneers. We want them to be on for as long as they can last. So in order to do this, the first thing we have to make sure of is we know what you want. So we have to do what we call a smile design first. If this is a process that you are not familiar with, if you go onto the website, you can find some video information on smile design. But in short, the smile design with the patient, we're going to create a model, a blueprint if you want, of what you want to look like. This information will be transmitted to my laboratory so they know what you want, and your porcelain veneers will be made. So the process will be, once we have that, patient will sit down in the chair, we will prepare your teeth to accommodate the placement of the veneer. Usually this is an extremely minimal amount of tooth preparation. In doing so, some people may need some form of anesthesia, numbing. In my office, we use an electronic anesthesia, which is virtually painless. It will not numb up your face or your lips. So it makes the process much easier for both of us to go through. So you'll be laying in the chair. We will minimally prepare your teeth. Once that's done, we'll take some impressions, and we can do that digitally nowadays also. We'll take photographs. We'll gather enough information so my laboratory knows where you start and where we want to go. And it's very important that we get this information because the color of your underlying teeth, how many teeth you show in your smile are all going to play an important role in the final outcome. We don't want to do too little veneers. We don't want veneers not to match because we didn't take into account the translucency of your natural teeth. So all of these factors are transmitted to the laboratory. Once we've done all of that part, we now want you to live with a prototype set of veneers. We want to make sure that when the laboratory builds your veneers, that they're going to be what you want. So you're going to leave with prototypes. We can change these. We can modify them before the permanents are made. Once we're at that comfort zone and we know that this is what you like, the laboratory builds these veneers. It only takes them a couple of weeks. You'll come back, we'll flip off your temporaries or your prototypes. We'll try in your permanents, and they will not be permanently placed until we are both happy with them. Because once they're on, they're yours, and hopefully we will not have to worry about these again for many, many years. If you found this segment on porcelain veneers informative, and this is a therapy that you've always wanted to go through, schedule an appointment with me for a consultation, and I'll discuss all your options, how many teeth you may need, what type of veneers, how long it will take. I'll answer all your questions so we end up getting a great result first time.